This is Rob Bray, and today we are talking with Dr. Rohan Jayasena, better known as Dr. J, a leading pediatrician in our area. How are you doing today?
I am going up. I'm great. I'm doing well. Thank you.
All right, well, first let's talk about where the pediatric offices for UHS Shenango Memorial are.
Well, there's one in Sydney, right at the old Gilda building, which is now a Shenango Memorial Hospital primary care building. And then, of course, there is in Norwich at the hospital on Newton Ave, there is the pediatric practice for Shenango Memorial in Norwich.
Okay, and what are a few of the good reasons for establishing a relationship with a pediatrician or a pediatric provider prior to a child's illness?
Well, then you have an established place to go in case the child gets sick, you have an emergency, you always have somebody you can call during the day, after hours, on weekends, because you already have an established provider. Also, you can go in for well-child visits, get the child immunized. All those are part of when you are established with the provider, a pediatrician. It's always better to be prepared and have a place to go. And if you have questions, you can always reach out to them. And if you don't have an established provider, you have no other resources except go to the emergency room or a walk-in clinic. And they don't have continuity of care, whereas your pediatrician, you have continuity of care from the child is born till the child ages out. I have patients who I've seen since they were born, since they were 2 days old, and now they are 19. So that is your home. We call it a medical home.
Okay, and why do you believe regular and scheduled vaccinations are important?
Well, vaccinations are very important because they protect you from some very serious illnesses. Meningitis, pneumonia, whooping cough, measles. There are lots of very serious illnesses that immunizations protect you from. A lot of people don't see that anymore because of immunization. People don't get those illnesses anymore. But if you go back 50 years, even 25 years, people used to get some of these serious illnesses. After a while, people do forget because you don't see them around. You think it's gone. If it is not gone, it is there, and the only reason people don't get those illnesses is because they are vaccinated or immunized. And like last year, there was an outbreak of measles, and there were communities where vaccination was not happening, and there was a measles outbreak. So it is important to keep up to date on your vaccines. It protects you from preventable diseases, and some of them can be life-threatening and very, very serious.
Is the COVID-19 issue this year making things different for children's vaccinations?
The vaccination has not changed one bit, the routine vaccination, but understandably parents are worried about bringing their children in because they're worried about exposure to other illnesses. So people are a little reluctant to get the vaccine because they don't want to come to a doctor's office and possibly expose their children. So what have we done for that? What we have done is we have separated well visits from sick visits. And if somebody calls that they're sick, we screen them, and if they're appropriate to come into the office, we see them in the afternoon. And we have the well children come in the morning, so there is no commingling of sick children and well children. So that is to reassure parents that their chance of exposure is limited. Plus, the staff is all wearing masks. Everybody washes hands. The staff, when they come into work in the morning, they take their temperatures, and if they are unwell, they don't either come in or they are sent home. So we have made it safe as possible for the patients when they come in. We also room you into the waiting room. From the waiting room, we room into your patient room as soon as we can, so you don't have to congregate in the waiting room. So those are the things we have done, steps we have taken to minimize exposure to illness from coming to the doctor's office. The second part of the answer is, even though we don't have a vaccine for COVID-19 yet, the vaccine will be available hopefully soon. Some of the complications that you get from COVID-19, like pneumonia, the vaccines you get for routine childhood vaccines, they actually decrease your chance of COVID-19 complications because some of the vaccines prevent pneumonia and other blood infections. So even though they directly don't protect you from COVID-19 itself, they protect you from complications. So that is another important reason to continue to do your vaccines even despite the pandemic.
Okay, and how does the provider, such as yourself and the nurses, comfort the child during an appointment?
Now, I myself have been in Sydney for 19 years, so I have been doing this for a long time, and I did my training 3 years before that. So I am very used to being with children and talking to parents and making them very comfortable. And we have dedicated pediatric nurses in the office, and that is what they do, and they have their own children. So we have all raised our children. We are excellent with working with children and making the parents and the families and the children and the babies comfortable by how we approach them and how we talk to them. And we are very, very friendly pediatric office. So by being very welcoming and being very friendly and being very approachable, we reassure not only the parents but also the children.
And one other issue that's popped up now, without all of the summer camps and the sports and school closing down early, there were not the constant reminders for parents to get their kids checked up and get all their vaccinations. There may be many more children this year when school starts that didn't get vaccinated. So what should parents do?
Well, what the parents can do is they should call the office and the staff can look into their charts and see when they have the last physical and if they are behind immunization. If the vaccines and the physicals are not up to date, the staff will be able to advise them. Well, you need to schedule an appointment now because when school starts, hopefully in September, you are not behind vaccines and you have up-to-date physicals. So if you call us, we might be going and doing some reminder calls ourselves, but we don't have a process in place yet. But for the parents, what they can do is, if you know when you had your last physical, then you know when you need one, new one. But if you don't know, most people don't know when they last had a physical. You can call the office and you'll be able to access your charts and let them know and advise them and get them in and get their physicals done before school starts.
Okay, and what's the phone number to make those appointments?
Well, the number is 607-561-2200 for the Sydney office.
All right, we've been talking with Dr. Jay. Thanks a lot for spending time with us today.
You're welcome. Thank you for having me.